Hello, my lovely anatomists and physiologists. Michele Glass here, and welcome back to our fifth video in our Chapter 1 series. And this conversation is all about what we call anatomical terminology. So this is basically how we can talk about the body positions, right? And so to begin, we need like a standard way of looking at the body, right? Because we can be positioned in so many different ways, right? And so we call this standardized positioning of the body anatomical position. And we would consider the body to be an anatomical position facing front. So here's my face, right? And then we would have our body, and then we would have our legs and parallel, so feet parallel together, arms at our sides, right? And then here's the significant feature. We need to make sure that we have palms face up, okay? Palms face up. And the reason for this is if you take a look at your forearm here, right? If you have your hand in one position or turn it the other way, what we see is a rotation of the bones of the forearm. So go ahead and put your hands at your side and take a look down at your hands. Put your palms facing forward with your face, and then rotate them to the back. And you can see how that changes the positioning of that arm in particular. So this is our standardized anatomical position that we would consider here. As we continue in the course, you're going to see a lot of terms that are used that are unfamiliar. So familiarizing yourself with these terms will be super, super helpful. So I'm actually not going to test you on these particular regions, but we will see these coming up as we study the coursework. So this information just will show up in our lab, it will show up in our lecture conversations. So even if you're not memorizing these terms, reading over, practicing it, becoming a little bit familiar will help. So this is your figure 1.2 coming directly out of your OpenStax anatomy textbook. I have a link to that chapter in the description of the video, so make sure you click on that. And when you're actually in the textbook looking at this particular image, your screen reader will read for you all of the different structures. So if you need an accessible document, make sure that you're accessing it directly out of the text. What we will be doing in our class and testing on in our class are what are described as directional terms. And so it's important to pay attention that these terms are also like relationship terms, meaning how does one structure relate to another? Now we will see these are opposites of each other. So we have the term anterior, or you can use the term ventral. For our purposes, we'll think of these as interchangeable. And then the opposite of this would be, so we'll just draw a line like this, would be posterior. And it has also the word dorsal that you can use instead. So for us, we'll think anterior and ventral as synonyms, although there's some slight differences in those terms. And we'll do the same with posterior and dorsal. What we're really talking about here is the front of the body versus the back of the body. Okay, then we can look at superior, or you can think of the word cranial here if you're talking specifically about the head. And then we have the word inferior, or you can use caudal if you're thinking specifically about the tail. In the case of the human, that would be the coccyx. Here then, the superior is really talking about the top, and inferior is really talking about the bottom. Cranial and caudal, remember, are specific terms. So you might want to remind yourself that this means head and caudal means tail. Okay, next we have medial and lateral. Now, medial is talking about, we could say, the middle, or more accurately in the body, the midline. So think of like your nose, think of your sternum, think of your belly button. These would all be medial points on the body, middle points of the body. And then maybe for a lateral, let's do like the edge. So here you could think of your ears, your shoulders, right? So the outer edges of the body. Okay, next we have what's called proximal and distal. Now with these terms, these are going to be associated with the appendages. Appendages is talking about your, what we think of commonly as arms and legs, okay? When we talk about proximal, think of approximate or close to. So this is going to be close to attachment point. Now, if we're talking about an upper appendage, that's going to be the shoulder. If we're talking about a lower appendage, the most proximal point would be the hip. Distal then is talking about far away from attachment. Again, if we're talking about upper appendage, the attachment would be the shoulder. So the most distal point of the upper appendage would be the fingers. If we're talking about the lower appendage, the most distal point would be the toes. Okay, and here's where we get into that relational piece, right? What would we say for the elbow? The elbow is in between the attachment point and the distal point. So how do we know? The elbow can be classified both ways. It depends on the relationship. So if I'm comparing my elbow to my shoulder, it's more distal. If I'm comparing my elbow to my fingers, it's more proximal. Okay, so it's a relationship term. The last set to look at is called superficial and deep. So superficial is like outermost, and deep is like central or internal. If I wanted to talk about a jelly donut, the superficial layer would be the powder or the glaze, and the jelly would be deep, right? So your organs are deep and your skin is superficial. All right. So the best thing to do with these terms is to make sure you understand the definitions and then practice using your body. So for instance, if we wanted to talk about the nose, we could say the nose is medial to the ears. It's in the middle. It is inferior below the eyes. It is superior above the mouth, and it's on the anterior or ventral surface of my face. I could do my ears, right? So my ear is lateral surface of my head, right? It is above my ear, so it's super, or above my mouth, so it's superficial to the mouth, and it's kind of below my eyes, right? So it's inferior to my eyes, right? So we can practice these terms. Okay, taking a look next at what are called body planes. So the body planes, you could think about in terms of a dissection, doing a physical cut through the body, like cutting up your loaf of bread. That's seeming a little bit primitive here. So we can also think about it in terms of just imaging. So we have medical imaging techniques that allow us to take different visual slices through the body. As we talk about body planes, then we're talking about these imaginary 2D surfaces or cuts, right? And so we have three that we want to look at. We have sagittal plane, we have frontal plane, and we have transverse, which can also be called a cross section. The sagittal plane is a cut here. So it's going to give us like left and right sides of the body. So you're cutting mid-sagittal is exactly at the midline, but you can slice all the way in that direction. Frontal plane is going to give you like a division between the front and the back, right? So that's like a slice here. And again, you can cut like loaf of bread all the way down. The cross section or transverse section is like a top and a bottom. So our slices would be like this. So that's kind of probably like more how we slice a loaf of bread. Next, we can talk about body cavities. So with body cavities, what we are looking at, we have two major ones. We have what we call the dorsal cavity, and then we have what's called the ventral cavity. Remember, dorsal means back, so the dorsal cavity is at the back. So this is actually going to contain your brain and your spinal cord. The ventral cavity is like your whole torso. So I'm going to say torso here. Ventral's front. Now we can divide the ventral cavity up into the thoracic cavity and the abdominopelvic. This is helpful when we're doing an anatomical discussion. Where is the heart located? It's located in the thoracic cavity. Where is the stomach located? It's located in the abdominopelvic cavity. Separating these two cavities, we have a smooth muscle, a skeletal muscle. It's controlled both consciously and unconsciously. The skeletal muscle is called the diaphragm. The diaphragm is separating the thoracic cavity and the abdominopelvic cavities. We should take a look at like what basic organs are located in the thoracic and what basic organs are located in the abdominopelvic. So if you take a look in your textbook, chapter 1, you'll be able to get a little bit of a nice overview there. When we talk about the thoracic cavity, we will see we have two additional cavities. So we're going to have the pericardial cavity, which is housing the heart. And then we're going to have the pleural cavity, which is housing the lungs. When we talk about the abdominopelvic cavity, we can divide it up just for conversation into what we call 9 regions or quadrants. And quadrant means 4. So if we do our 9 regions, you basically want to construct for yourself like a tic-tac-toe board. So here we're looking at our abdominopelvic regions, and we would see in the center would be the belly button. And so we're going to call this region the umbilical region. Up above, we have the epigastric region, where that prefix epi means above or upon, and gastric is like belly. And then we have hypogastric region below, where hypo prefix means below. Okay, then on either side of the epigastric, we have hypochondriac, where chondro means cartilage, and this is referring to the rib cartilage. So hypochondriac is right underneath the ribs. And notice that we have on each side. And so we have a right side and we have a left side. Now it's important when you do left and right that you do your model, your diagram, your patient, your subject, and not yourself. So this would be a mirror image of myself. So this side here is the left and this side here is the right. So left hypochondriac region and right hypochondriac region. On either side of that belly button, on the either side of the umbilical region, we have the lumbar. So again, we have the left lumbar region and the right lumbar region. Lumbar is in lower back. And then we have inguinal, which means groin area. That's one of our terms talking about groin. And so the inguinal region is on either side of the hypogastric, or you can call it the iliac region, which is talking about a part of your hip bone, your coccygeal bone. Now, this is going to be a really specific way of kind of like slicing up the abdominopelvic region. So this would be really important for like an anatomist who wants to be very specific about location. If you're more like a clinician, and you are writing down like a patient is complaining of pain in such and such area, you can just then divide. Sorry about that. If you are a clinician and you're recording, a patient's complaint about pain in such and such region, you can just think of dividing that abdominopelvic region into 4 sections, using that belly button as the center. And so this is really nice. So you just have the left upper quadrant, left upper quadrant, right upper quadrant, left lower quadrant, right lower quadrant. Okay. And so we can talk about the abdominopelvic region. These are like superficial designations. These are things that humans are doing just to make it easier to talk about these organs and where they're located, right? Okay. To sort of finish up our conversation, we have what's called the serous membrane or the serosa. And this is going to actually line your body cavities. Now, those body cavities then that we're talking about are fluid-filled spaces. Okay, this is super important. This means like your skeletal muscle of your chest and your belly can move separately from the movement of the heart, movement of the lungs, movement of the stomach, right? And as those internal organs move, you don't have friction up against a body wall because of this fluid in these fluid-filled body cavities. So this is providing a lot of cushion. This is reducing friction between your organs and your body wall. Or if you think about that thoracic cavity, between reducing friction between the heart and the lungs. So they're doing separate movements. Your serosa or serous membrane is lining these body cavities then, right? And we'll see that it has 2 different layers. So we have what's called the parietal layer, and this is going to cover the body wall. So it's lining the body wall. And then we have the visceral layer. Now, anytime we see this word visceral, viscera, I like to just kind of translate this in my mind to guts. These are my internal organs. So this is my innards, the stuff inside that torso. The visceral layer is going to cover your organs, covers the organs. So it's actually forming part of that organ wall. Kind of in between is the fluid. So fluid is going to be located in between the parietal layer and the visceral layer, right? And so that's going back to this significance of cushioning those internal organs and reducing friction as your organs move, right? When we talked about the thoracic cavity being divided up into pleural and pericardial cavities, you know, that's different sections of the serosta making little fluid-filled sacs for those organs and keeping them separate, reducing friction and all that. When we talk about the abdominopelvic cavity, so we can go back just a minute. When we talk about, so here we're seeing the pericardial and pleural cavities. When we talk about the abdominopelvic cavity, we'll see that that section of membrane is called the peritoneum. So that's going to be really like another name for a body cavity. Okay. Stay tuned for one last video out of chapter 1. And as always, take care of yourselves and each other.